let's talk about constipation because it's uncomfortable and it's not something that you necessarily have to deal with. Signs and symptoms of constipation are it's harder to get poos out of your body than it should be, but regular is different for everybody. So it's good to know that regular bowel movement frequency can be anything from every 3 days to 3 times a day. So it's most important to know what's normal for you. And if there's a change from that normal, that's what we want to be looking into. You might be experiencing constipation if you have pain with bowel movements, if you find that they're hard to come out, if you have any bleeding when you wipe, or generally if you feel like you have to sit on the toilet for a really long time and push against some resistance and it feels like nothing's happening. So let's go over a few tips that can help with the setup and actually getting the setup of your body, actually getting bowel movements out of the body, and then some preventative dietary suggestions and others that can help with constipation. So imagine this is a toilet. It is a beautiful plush IKEA toilet. I have a squatty potty here that I think is super helpful if you're someone who deals with a lot of constipation or someone who is pregnant and or postpartum, and maybe this is going to be a hormonal thing that you are struggling with for a little while. Yes, constipation is normal when you're pregnant because your bowels get so obstructed by the growing baby, but postpartum it's also really common. So anyways, a squatty potty, now let's keep in mind I'm kind of sitting on a very low toilet. But a squatty potty helps to set me up in a more aligned position. And this would be like around the toilet bowl. Why this is an ideal position is because my pelvis is fully open in the bottom, meaning my pelvic floor is in a lengthened position. Whereas if I'm sitting into the toilet and my legs are down here, I have less pressure naturally pushing down towards my pelvic floor. And that's not like excessive pressure, that's just helpful pressure. Think of how people used to have bowel movements back in the day when there weren't toilets. It is an evolutionary position to be here. So anyhow, knees up above your hips is a cue. Nice wide sit bones is another cue. A lengthened spine can help the large intestine empty and the rectum empty. And then thinking about kind of leaning forwards like I am here. So you can see how a squatty potty really helps with this position. That's the setup. The actual doing part is thinking about letting it out rather than pushing it out. Our sphincters, our rectal and anal sphincter, work together to get bowel movements out of the body. So when your rectum recognizes something in there, there's certain stretch receptors that feel something in there and it sends a signal to your body. And what it does is it contracts that sphincter and relaxes the other sphincter. The anal sphincter is more part of the pelvic floor. And what I often see in clinic is that people try to, I have them mimic as if they're having a bowel movement. And what they do is they start to bear down and they contract their pelvic floor. So you're actually closing the exit point, making it that much harder to pass a stool. So what you want to think about is, can you take some relaxed breaths down into your body, down into your low back, down into your pelvic floor, thinking about lengthening and relaxing those muscles and allowing the natural constriction of your body to push the stool out of your body. Also know that if you need a little bit of help, try not to contract from your rectum, but try maybe to contract a bit more through your abdomen. Notice if when you're trying this, maybe watching this video, if when you do that, you're also contracting around your bum. Okay, so you want to think relax the pelvic floor to let it out rather than pushing it out. Another helpful tip of the actual doing is think about when you're doing it. So we don't want to be sitting on the toilet pushing and pushing and pushing because it doesn't set us up for as much success. We want regular bowel habits to be happening. So ideally it's in the morning, drinking a glass of water if you're someone who drinks coffee, and about 30 minutes after you eat or drink is like the ideal prime time to have a bowel movement, and that's not the case for everybody. But if you get the signal, go to the bathroom. And if you don't, and if you feel like you're someone who struggles to feel when to go, that is how to create the habit, is to sit on the toilet for a few minutes, widen the pelvic floor, relax, take some deep breaths, see if anything happens. But if it's not happening, then come on up and just go about your day until you feel the sense to go. Other things that can help with triggering the sense of needing to go to the bathroom is hydration. So we know that being dehydrated leads to more constipation. Thinking about fiber in your diet. So fruits, vegetables, whole grains, some really helpful things. I'm not a nutritionist, but some helpful things would be like pumpkin seeds, apricots, prunes, but also just like fibrous-y foods. Mostly just eat like a natural diet and it'll help. And then exercise is really helpful for passing things. So it helps to keep the organs or the intestines get a little squish, and it helps with blood flow, which helps with digestion, which helps with passing stool. So those are some tips. There's a few more that I would say even, one last one. It's called the ILU massage. If you are someone who struggles with constipation, your large intestine goes all the way along your abdomen. And so thinking about gently sweeping up along this part, that's the I, and then up and over would be the L, and then up, over, and down is the U. This can be really helpful if you know that it's kind of coming, but it's not totally coming. Try that out, and it should help the intestine kind of get things going a little bit more. If you have any questions, come see Pelvic Floor Physio. My name is Rochelle and I work at Mod. So I hope those are helpful tips.